3 more minutes, guys. We'll start soon. Okay, shall we start, Rupal?
Yeah, let's start.
Yeah.
Just give me a second. All right, guys. I hope everyone's ready. We are back with Juxtamed and you guys, right? And today we start with Ophthal, the eye, the eye. Now it's all about point of view, right? So let's get started. First question in front of your screen. A 55-year-old male with long-standing type 2 DM presents with gradual painless blurring of vision in both eyes. Fundoscopy reveals multiple microaneurysms, heart exudates in a circlinate pattern, and macular thickening. OCT confirms retinal thickening involving the fovea. What is the first line management?
So here think of vascular complication of diabetes, right?
Right.
It's anti-VEGF.
All right, guys. So you're doing great.
Okay, let's move to the second question. 60-year-old male with history of cataract surgery 2 months ago presents with sudden painless vision loss in the left eye. He described seeing flashes of light and curtain descending over his vision. Fundoscopy reveals a superior bullous retinal detachment. What is the appropriate next step?
While you can see, this is a site of threatening emergency. What is the immediate step to restore the vision? What do you think?
Okay,
Wonderful.
okay, we have Krishna leading now, followed by Dr. Max, Myra, Darshini, and Bhagya.
You know, with the Max name, I remember there's a series on Netflix and it's all
Mhm.
about the hospital and the
Mm.
managing and everything. Let me read out the question for you guys first and I'll tell you. So, all right, the question is an elderly male with a history of hypertension and atrial fibrillation presents with sudden painless loss of vision in his right eye. He describes it as black curtain descending over his vision. His visual acuity is counting fingers in the left affected eye. What is the most likely diagnosis? This is a neonate and a baby question.
Right, it is CRA.
Right. So it's all about that Dr. Max. See
Mm-hmm.
if it is him or not.
Mm. Okay, we have Myra now, who is leading in the first place, and second place we have Darshini and Krishna in the third place,
Right.
followed by S. E. Hemant, Faizi, Dr. Max, Darshini, Mohan Kumar, Bhagya, R.K., Naga, Vishnupriya, C. Ashish, P. Thor, Aisha, and Fab. Okay,
What PP is what papillary carcinoma.
Fab. Okay, a female presents with sudden onset severe eye pain, headache, and nausea. Her right eye appears red with mid-dilated non-reactive pupil. IOP is 48 mmHg. Slit lamp exam reveals a shallow anterior chamber and corneal edema. What is the most likely diagnosis?
Right. So likely diagnosis, what it would be. We can see that there is a rise in intraocular pressure that can lead to this classic triad of symptoms. What is the likely diagnosis?
Right, it is acute because red eye is there, mid-dilated non-reactive, IOP is very high, so it is an acute case.
All right, so we got Myra on top. Then there was someone E also. E is what?
Hmm.
Ecstasy.
Okay.
All right, so a 60-year-old male with uncontrolled diabetes and hypertension is diagnosed with primary open angle glaucoma. Though asymptomatic, he has IOP of 28 mmHg bilaterally, and Humphrey visual field testing shows early accurate scotomas. What is the correct sequence of vision loss in primary open angle glaucoma?
Yeah, the sequence is very important. Most of you have got it right.
Wonderful. Let's keep moving forward. Myra is just gonna be in the top of the need PG, I think, if she's appearing for it.
Hmm.
All right,
Okay,
guys.
let's
Yeah.
sixth question. 55-year-old woman presents with sudden severe eye pain, headache, and blurred vision. Again, IOP is 50 mmHg, mid-dilated and shallow anterior chamber. After initial medical management, procedure is performed to create a hole in peripheral iris. What is this procedure?
As we can see, this procedure helps in relieving intraocular pressure by improving aqueous humor drainage. What is it called? We're asking you the name of the surgery.
Yeah, it is laser iridotomy. Can you tell us the at what part of the eye they do in the upper segment or lower segment
Hmm.
in the
Yeah,
comment section?
which one is it? All right, so we have Myra with the longest as well as on top, followed by Heyman, then Faizi, then RK, then Mohan Kumar, Krishna, Dr. Max, Naga, Darshini, Ashish. So, all right, guys. So, you're doing great. Let's keep up the pace. Moving on to your seventh question. A 30-year-old male presents with sudden painless vision loss in one eye. Examination reveals a relative afferent pupillary defect, that is RAPD, but fundoscopy appears normal. MRI shows demyelination of the optic nerve. What is the
So
most
this, yeah,
yeah?
this condition is often the first manifestation of demyelinating disease affecting the central nervous system. So let's see what diagnosis you make. It is optic neuritis, but there is demyelination, right? It is multiple sclerosis.
Hmm, nice.
Okay, in YouTube comment section, we have Komal and Asadi giving us the right answer. That is in the upper segment.
Hmm,
In order to prevent diplopia, I think, any visual disturbances.
nice
Right,
work.
guys?
All right. So moving on.
Okay, a 45-year-old male presents with drooping of right eyelid and unequal pupil size. On examination, the right pupil is smaller and there is anhidrosis on the same side. Pupillary reaction to light and accommodation are normal. Which of the following is the most likely diagnosis?
In case you're thinking we're gonna give you a clue, there you go. The clue is in front of you. It is a classic triad pointing towards dysfunction of a specific sympathetic pathway. What is the diagnosis?
Right. Horner's disease, Horner syndrome, sorry.
Right. So great going, guys. Let's keep moving forward. As you know, it's not the end until it's end. Let's move on to your next question. A 55-year-old man with long-standing diabetes and hypertension complains of gradual vision loss in the superior quadrant of his right eye. Which specific optic fibers are affected?
So here think about a pathway of optic nerve uh, and which control this visual field region.
Hmm. What do you think? Will they get it? It's a previous need question.
Hmm. No, it is pie in the sky defect.
So we can see like most of you have got this right.
Okay, moving
Oh,
on to the last question.
A 60-year-old male with a history of hypertension and atrial fibrillation presents with sudden painless vision loss in his right eye. Automated perimetry reveals a cookie cutter altitude visual defect. Which artery is the most likely involved?
So this pattern suggests an infarct in critical artery, supplying the inner part of retina. Right,
Guys,
it will be, yeah,
yeah, yeah, you guys are given the right answer. Now we're about to tell you that there are around eight of these types, and they always want to ask you one of these ones. So remember that this is the most important topic in your uh,
neuro.
easy, yeah, and easy as well to remember. So please don't. Iris, yeah, you got to remember yourself also, along with the neuro of that.
Yeah, yeah, let's see the winner. Obviously, it's Moira.
Woohoo!
Okay, congratulations, Moira.
Congratulations, Mara.
And congrats to Faizi and Dr. Max as well.
Right. So congratulations to the winner as well as the runner-ups. You guys have been doing great, and it shows on as you are on the leaderboard as well. And congratulations to all of you guys being consistent. This is a great going. So let's keep moving forward and keep completing our syllabus every night at 10 p.m. onwards.
Okay, guys, we'll meet you in the next quiz.
Right. Till then, keep revising. Good night.